new to Botox, then I always say start a month early, right? That
I
way,
agree totally. Yeah.
right, you can come in
Yeah.
at your 2 week mark. We can see if we need to make any
Right.
tweaks, and then
Great.
then you'll be perfect for those events.
Love.
The holidays are right around the corner, guys, and we're going to talk about what you should be doing to look and feel your best for all of those holiday parties that are coming up. I'm Dr. Smita, board-certified plastic surgeon. I've got Dr. Amalfi here, and we're your hosts for Lipstick and Lipo, your unfiltered guide to plastic surgery. So let's just dive deep because the holidays, it is a busy time of year. We are out in the public. We're having fun. We're seeing all of our relatives and friends that we haven't seen probably since the last holiday. So I feel like there's like a perfect timeline on when to start the refresh process, right?
Yes. I
Yeah.
mean, I guess the bottom line is like that the minor stuff you can do like a little closer to the holidays,
Yeah.
but the major stuff you want to be doing like with a month or
Yep.
two of recovery. I would say fall and on gets to be busy time of season for plastic surgery in general, because if you're doing bigger things when it's a little bit cooler in more like seasonal climates, then it's easier to hide, your surgical recovery. So a lot of people are squeezing in surgeries around this time. And I think that's really awesome and really normal and honestly totally fine, because holidays are not really like you're around family and friends and stuff like that, but it doesn't have to be strenuous. And so I think it's totally fine months leading up to the holidays and even weeks leading up to the holidays that you're having surgery, especially surgery on your body that you can hide and kind of easily get over. But then like let's talk about more invasive facial stuff, because you want to make sure that you have time to heal, for your skin to heal, and for swelling to go down. So what do you think about facial surgery and procedures?
Yeah. So I think for facial surgery, right? I mean, I think it sort of falls in the same timeline as other body surgeries, right? Give yourself at least 6 weeks, a couple of months beforehand, because you will, especially if you're doing a facelift or a neck lift, there will be
Yeah.
bruising, you will have swelling,
And
everything's
you
going to
can't
feel,
hide it.
you can't really
Yes.
hide it unless you're using your hair to cover everything. So give yourself some time beforehand, but then certainly facial, like non-surgical things, I think you want to be able to see those results of your Botox and your fillers without the bruising before these events, right? So, you know, I would sort of look at your calendar, and whenever you really have your first parties or your Thanksgiving holidays or whatever it is, I always say Botox, like good time, unless you already know your dosage, right? You've been really regular and you get the same amount
Right.
every single time, then do it 2 weeks before, right? You're going to get consistent results. You're going to see the results by then. If you're new to Botox, then I always say start a month early, right? That
I
way,
agree totally. Yeah.
right, you can come in
Yeah.
at your 2 week mark. We can see if we need to make any
Right.
tweak, and then
Great.
then you'll be perfect for those
Love
events.
it. I agree.
And then
I
fillers,
agree.
you agree with that too, right? And then for fillers, I say a couple weeks, right? Just enough that
Yeah,
the swelling
same.
goes away.
Within that 2 to
Yeah.
4 week that 2 to 4 week little window is gonna give you enough time for, like, some swelling. I mean, because sometimes even if you have done filler and Botox and stuff, and you've never had a bruise, like, if you're doing it leading up to a big event, you could have a bruise. Like, I've had black eyes from almost nothing, and then you can cover it up with makeup, but if it's really important, like, you don't wanna be doing that. That's stressful. So, nothing with a needle within 2 weeks of an
Yeah.
event.
No, I love how I feel like patients say this all of the time. Oh, well, I never, like, for the first timers, I've never bruised before. I'm like, okay, but every injection is its own thing, um,
Event. Yes.
right? It's its own singular event. So always
Yeah.
just for that.
You could never bruise, like I bruise sometimes, and then sometimes I have like a ton of filler and like there's nothing. And so you just like, you really cannot count on that at all. And it actually usually and most often has nothing to do with your injector. Like some people will be like, oh, I don't go to that person because I bruise. Well, we're injecting things into your skin that has blood vessels. Like it's common. It's not like a sign of someone's skill. It's just a biologic response.
I
So
know. You, right? Like, are you taking a bunch of supplements? Did you just have your period or have back pain and you took a bunch of ibuprofen?
yes,
Uh, did you just have like a weekend where you were traveling and you were drinking a lot of wine? Like all of
yes,
that contributes to whether you
that's
bruise or not
yes.
also.
Yeah. Yeah, your body is pure chemistry, you guys. So like that is not a skill thing. But like if you're a couple weeks out, like there are probably some like if you're 2 weeks or less, like you could do like some kind of like glow up facials and like lighter chemical peels and stuff like that. Like I think there are some refresh things that you can do with a really short timeline. Like, sometimes I do stronger chemical peels, but if I'm close to an event and I just want that like glowy look, you can do a really lightweight chemical peel, and that's going to give you just a little bit of a glow for the next few days, which sometimes is all people need. So there's like options
Yeah, or
every
like and
every time.
like there's always something you can do, right? The light
Yes.
chemical peels, microneedling, probably,
Yep.
like 3 before, but like just even a hydrafacial, right? Just like
Hmm.
an extension hydrafacial,
Amazing.
dermaplaning or something, so your makeup just goes like you just get this beautiful glow, and that you can do
Yes.
the day before. Um, so lots of options for you to look and feel your best before the holidays, but certainly you want to time some of these so that you don't have to deal with bruising or any of the swelling that can sometimes result.
Yeah. So plan ahead, you guys.
Mhm.
Surgery, then fillers, then Botox, and
Yeah.
some chemical peels close up. But you can do, all of them or
Well,
some of them. And the better you plan ahead,
yeah.
honestly, the more
Or
comfortable you're going to be and then not stressed.
yeah. I mean, or right, I think both of our practices, like the busiest time of year for surgery is literally around Christmas, like the
Yeah.
day after. And so, or you can just plan your surgeries when you have holiday time off. So
Yeah.
either or works for us, but we just want you guys to look and feel the best for the
Awesome.
events that are important to you.
All right. Well, the holidays are here. Come find us and, we'll kind of tackle the whole menu for you. And make sure that you are subscribed to Lipstick and Lipo. We are on YouTube, Spotify, Apple, and on Instagram as well. So we will see you guys next week. Happy holidays.
Happy holidays. Bye, guys.